Good evening, everyone. My name is Claude Robinson, and I'm honored to serve as the Executive Vice President of External Affairs and Diversity at UCAN. UCAN is a 152-year-old organization that strives to build strong youth, children, and families through compassionate healing, education, and empowerment. And over the past 5 years, we've had the pleasure of working closely with UIC and Amanda Lewis and Yvonne Arenas with the outstanding reports that they put out around issues that are pertinent to diverse communities and issues that oftentimes aren't talked about in a consistent basis. So tonight, we're excited to share with you the new report, Deadly Disparities in the Days of COVID-19, How Public Policy Fails Black and Latinx Chicagoans. And at this time, I'd like to introduce Amanda Lewis, who's going to lead us further down this exciting time together. Again, thank you for being with us, and get your pen and paper out. Let's take some notes and learn and have some fun tonight. Take care.
Thanks so much, Claude. I want to appreciate you and UCAN and everyone on your team for the ongoing partnership. My name is Amanda Lewis. I'm the director of the Institute for Research on Race and Public Policy here at UIC, and I'm thrilled to have everybody here tonight to join in this important discussion about our new report on COVID-19 in Chicago. Before we get into the substance of the report, I want to offer some appreciations and a few logistics. First, to the entire research team who tirelessly worked to bring this report to life. There was talk early in March 2020 as the pandemic was initially unfolding that we were, as they said, all in this together. But it was clear almost immediately that that wasn't quite the case. While no one would escape the effects of the pandemic, the most marginalized and most vulnerable in society were both hit the hardest by the disease and most impacted by all the economic fallout that followed in the wake of the pandemic spread. As these racially disparate effects started to become visible in Chicago, IRRPP partnered with principal investigator on this project, Dr. Claire Dakota, who I'll introduce in a second, and a group of local scholars to try to understand what was happening locally and which policy efforts were working. Professor Dakota then led a team tirelessly for the last 20 months to launch the project, interview over 150 residents, policymakers, community organizers, public health and medical professionals, et cetera, to understand what happened in Chicago and why. So we want to thank the original research team that got together and had these conversations with us. That includes Patricia Macias Rojas, Eve Ewing, Gayatri Reddy, and Anna Guevara. A huge thank you to the graduate students who worked tirelessly to recruit, interview, transcribe, and analyze and draft all the things necessary to do this research. That includes Cal Lee Garrett, Cynthia Brito, Fructoso Bazaldua, Jasenia Vargas, Dakari Finster, and Irma Ramirez. Always deep thanks to the IRPP staff who've put in extensive effort and overtime on the report to make this release possible. And that includes Yvonne Arenas, Dina Lewis, and Chris Poulos. And thanks to our UIC partners who helped fund this project quickly. We wanted to launch it right away and get it off the ground, which meant needing to reach out to colleagues and friends, including folks at the Institute for Policy and Civic Engagement, the Center for Clinical and Translational Services, the Institute for Health Policy Research, and the Literature Arts and Sciences College Committee on Social Science Research. A couple quick reminders. We have several partners who joined with us to sponsor these launch events. That includes not only UCAN, but the Chicago Community Trust and Chicago African Americans in Philanthropy. And you can find, Dean, I believe just dropped into the chat a link where you can find a link to this report and all of our previous reports, which you are welcome to download for free. And we will soon have hard copies of the report available also. A few last housekeeping issues. We are recording this for those who aren't able to join today. So just to let you know, please submit your questions anytime during the presentations using the Q&A function in Zoom. The live transcript will be on, but you can turn it off anytime. And we apologize ahead of time for any errors as it's not always the most accurate. And I think that's it. I'm really excited now to turn things over to our first speaker, Dr. Claire Dakota. She's a professor of sociology at UIC and the author of several award-winning books on the social construction of health and disease, the politics of knowledge production, and people's experiences with healing and healthcare systems. It's all you, Claire.
Thank you. Thanks so much, Amanda and Claude, for the welcome. And I really look forward to our conversation today. So I just want to begin my comments today with a story from one of the 100 interviews with residents of vulnerable communities in Chicago. Maria is an undocumented Latina and a single mother who's lived in Little Village, which is a neighborhood in Chicago, for 15 years. She was working for a mailing company at the start of the pandemic, but she got laid off. She started then working for a temp agency that provided no benefits. She tested positive for COVID-19 in September 2020, but she had to continue to work. She told us, "The truth is, I didn't want to inform them I didn't want to leave because I know I'm not a permanent employee and I don't have benefits." Maria explained to us how prevalent her situation was in Little Village. She said, even if people are sick, they have to work. Who's going to help with the expenses? And she scoffed at the label of essential, explaining they kind of take advantage that you can't say, okay, why do I have to expose myself and accept what you guys give me? I am exposing myself, so why don't they give us help? But yeah, they kind of take advantage of the fact that you can't speak up. Maria had to leave her elementary school-aged children at home to do remote learning while she worked because she had no money or family to provide for childcare. With no savings to rely on, her debt continued to mount as the pandemic stretched on. As an undocumented American, she was ineligible to receive unemployment benefits or the stimulus checks. And she worried about her accumulating debt to her landlord because if she was evicted, she explained, quote, "I wouldn't have a clue what would happen if they told me to vacate the apartment." So this is just one account of the disproportionate impact that COVID-19 has had on Black and Latinx residents of Chicago. Overall, Black and Latinx Americans, this is at the national level, have died at 2 times the rate of white Americans, and Latinx Americans have had the highest rates of infection throughout the pandemic. This slide here indicates the disparities in cases, hospitalizations, and deaths by race in Chicago. Chicago is a majority minority city in which white, Black, and Latinx residents all make up approximately 1/3 of the population, and approximately 6% of the city's population is Asian. In this slide, we see that Latinx communities bore the brunt of infections. On the left-hand side, you can see this in the cases. So the Latinx population had 35% of the cases overall. Case rates are similar between Black and white residents of Chicago. But of course, as you can see in the second and third, in the middle and the right-hand side of the slide, Black communities suffered with much higher rates of hospitalizations and deaths. So this report really seeks to understand a little bit behind some of these numbers, as well as some of the other impacts that the pandemic has had on Black and Latinx residents of Chicago in particular. So in addition to suffering from higher case and hospitalization and death rates, Black and Latinx Americans are more likely to have been laid off and to be months behind on their rent. So COVID-19 is not only an infectious disease, but it has exacerbated the already profound economic, housing, education, health, and mental health precarity of people who are marginalized on the basis of their race, class, and legal status. When news first surfaced in March 2020, that deaths from the coronavirus were concentrated in Black communities, and then in April that infections were concentrated in Latinx communities, the city of Chicago and Illinois state officials responded with data-informed racial equity initiatives. Both Governor J.B. Pritzker and Mayor Lori Lightfoot have dedicated resources to tracking racial statistics on infection and death. They reduced barriers to testing and monitoring. They expanded surveillance, healthcare, and vaccination access in Black and Latinx communities. And yet racially marginalized Chicagoans still experience disproportionate levels of infection and death, as well as health, housing, financial, and welfare insecurity. In fact, federal, state, and local governments have all extended tremendous resources to address the health and racial disparities that were associated with the pandemic. And yet, according to the Chicago residents that we interviewed for this project, the policies that were designed to help the most vulnerable did not meet existing need. Why? So in our report titled Deadly Disparities in the Days of COVID-19, How Public Policy Fails Black and Latinx Chicagoans, we report on data that was gathered between August 2020 and October 2021. This is some of the information about the interviews that we did in neighborhoods. We interviewed 100 residents of 3 neighborhoods that were heavily impacted by COVID-19 in Chicago: Austin, Albany Park, and Little Village. We focused on these 3 neighborhoods because of their racial, socioeconomic, and immigrant composition. The information on the right-hand side of the screen is available in the report, which you can download. I know it's a little bit hard to read on the slide, but here we see that Austin, if you aren't familiar with these neighborhoods, is a primarily Black neighborhood, and the median income is much lower than the average for the city. Little Village is a primarily Latinx community with a large immigrant population, and the median income is also lower than the city's average. Albany Park on the north side of the city is a much more racially mixed neighborhood with a much higher median income than the city as a whole. And yet our report also explains that Albany Park actually suffered from worse hospitalization and death rates than either Austin or Little Village. Likely because it has a large immigrant population, a large refugee population, and it was not targeted by the city for additional resources. So in addition to just sort of understanding what was happening in the city of Chicago, we also wanted to audit the racial equity policies that were implemented in the city of Chicago. So we chose 2 neighborhoods that were targeted specifically by city government for extra investment, and that was Austin and Little Village. And then we also asked people about the implications about the lack of investment in neighborhoods like, lack of additional investment in neighborhoods like Albany Park. In addition to these 100 interviews with residents, we also interviewed 45 state and city officials, epidemiologists, healthcare providers, and community organizers. We sought to understand which policies and programming were working and which were failing to meet existing need during the pandemic. In the report, therefore, Chicago is both a lens for critiquing the federal approach to COVID-19, as well as a means of auditing Chicago-specific policies and their successes and their weaknesses. In the report, we offer 4 main explanations for why existing policies did not address existing need amongst many vulnerable Chicagoans. So our first explanation is that a lack of a safety net for lower income and working class Chicagoans. So decades of discriminatory policies on housing, healthcare, and social security, as well as disinvestment in poor neighborhoods, meant that lower income and working class Chicagoans did not have a safety net to rely on during the pandemic. While middle class Americans with liquid assets and accumulated wealth also experienced, of course, disruptions to their employment, they had safety nets to help them weather financial setbacks. So in this slide, we see that 1/3 of Black and Latinx households have no real safety net to rely on. So this is actually from 2011. This is obviously prior to the pandemic, but here we see already a sort of existing lack of existing social safety nets for many Black and Latinx households. Black and Latinx households are also liquid asset poor. We include details about this in the report itself. And the findings there are even potentially more stark. So this slide basically illustrates how lower income Black and Latinx Americans don't have existing financial cushions, and many faced barriers in addition in accessing social assistance. The Latinx and Black working poor were made vulnerable to infection because they were most likely to be employed in low-paying front-facing jobs. So on this slide, this is demographics of frontline workers in Chicago. On the left-hand side, we have the sort of breakdown racially of all workers. And then you can see on the right of the red line, you can see the kind of breakdown by race in different kinds of frontline jobs. So for example, in public transit, you can see that 57.7% of those employed in public transit are Black residents of Chicago. So Black and Latinx workers in this slide, it's very clear, are overly represented in frontline labor. And you can see for the most part, they make up 60% of frontline workers. And many had no choice but to keep working during the pandemic. The story that I told about Maria at the beginning of my comments really illustrates these pre-existing structural inequalities and the important negative impacts that they've had on vulnerable Chicagoans. In addition, lower income Chicagoans of color also suffered worse outcomes because they already faced health insecurity because of pre-existing conditions and lack of sufficient access to health care. Sorry, this slide shows us 2019 insurance access. So this is again pre-pandemic, broken down by race. So we see, first of all, the numbers of the uninsured are higher for Black and Latinx residents, especially for Latinx residents. And then in addition to that, the highlighted areas represent folks who have their insurance through their employer. So if you lost employment during the pandemic, many people also lost their health insurance. So both Latinx and Black Chicagoans already faced financial and health insecurity, and many found that existing vulnerability was compounded by pandemic conditions, which led, of course, to higher rates of infection, hospitalization, and death. Now, these conditions are not unique to Chicago, but Chicago's long history of residential segregation and neighborhood disinvestment often exacerbated people's existing vulnerabilities. So the second mechanism that we talk about for how existing policies failed to meet the needs of the most vulnerable in Chicago is that at the federal, state, and local levels, COVID-19 was treated as a health crisis and was fought through a series of public health solutions. However, the residents that we interviewed experienced the pandemic as a much broader crisis that was associated with housing, food, employment, and childcare insecurity. So these next slides are going to show you some snapshots of statistics from about six months into the pandemic. So 6 months into the pandemic, this is a snapshot of the Chicago metro area households that were behind on their rent payments. So here we can see already 6 months into the pandemic that 32% of those who were behind on their rent were from the Black community and 18% were from the Latinx community. And of course, we can also see from this slide that people who had no college education were more impacted by a sort of rent burden and rent debt only 6 months into the pandemic. And then this is another 6 month pandemic snapshot. So 6 months into the pandemic, Chicago metro area households that had lost income. So again, here we see a very clear and stark racial disparity where 65% of Black households and 68% of Latinx households lost income, had lost income 6 months into the pandemic. And then here is another 6 month pandemic snapshot where which illustrates the households that had significant childcare disruptions. And again, we see a large burden for Black and Latinx households. In the report, there's actually a series of these snapshots that we offer 6 months into the pandemic to illustrate the wide-reaching impact that the pandemic had beyond the medical impact that it had or the health impact that it had for households. And all of these snapshots come from US Census Household Pulse Survey data. And there's significantly more data that we offer in the report if you're further interested. Residents told us again and again in interviews that while the loss of life due to COVID-19 was of course profound and certainly traumatizing, but there were also a wide array of insecurities that they were facing. For example, when asked how the pandemic affected her neighborhood, one Black woman from Austin commented, "Within this pandemic, we've had so many other demics. There's a violence demic, there's the losing my job demic. It's just been so many demics to add on, which causes, of course, more mental health issues." Dan Fulweiler, who's CEO of Esperanza Health Centers, which is a series of federally qualified health centers that offer services to residents regardless of their ability to pay, explained to us in an interview that the trauma that residents were facing went well beyond the loss of life. He explained, "There's the trauma from disease and death, and then there's also the trauma from not having money to pay your bills anymore because all of a sudden you're out of work. Even if they didn't get kicked out of housing, they were living with the stress and anxiety of not being able to pay their rent. You were traumatized if you had to go to work, and you were traumatized if you got fired, either way." In another instance, a Latinx man from Austin explained that the focus on health issues often obscured the broader crises that his community was facing. We have health issues, of course, mental issues, mental health, drug abuse, alcohol abuse, domestic violence, crime. Just like the very mask I wear and you wear, that's what's happening. Everything is being masked, masked, masked. Racism is still an issue, undiscussed, again, hidden. So as this man suggests, often these broader insecurities were given lower priority for federal, state, and local actors. And in fact, if financial and housing security had been prioritized as a preventative public health strategy to protect the vulnerable, then marginalized communities may not have borne the brunt of infections and death. Most housing and cash assistance programs were designed to address the economic fallout of rising unemployment. This shows pre-pandemic rent-burdened households. So again, we see a massive racial disparity between Black and Latinx households and white households on rent burden. So rent burden measures the number of people who spend more than 30% of their household income on rent. And here, of course, we see that before the pandemic, 52% of Latinx households and 60% of Black households spent more than 30% of their household income on rent. Then on the right side of the screen, we see how people used their stimulus checks, their very first stimulus check. So this illustrates how just a few months, about 8-9 months into the pandemic, people were already so indebted that they were just trying to keep up. And they spent large portions, many people spent large portions or spent their entire stimulus checks simply to pay back their debt. And we, of course, spoke to many people who were trying to juggle food, rent, car payments, childcare, and were falling further and further behind. Rental and cash assistance programs were made available after vulnerable residents had begun to accrue additional debt. By that point, many residents had already put themselves and their families at risk by continuing to work due to financial and housing insecurity. If financial and housing vulnerability was treated as a public health risk for the poor, then policies would have attempted to preemptively protect them from housing and financial precarity, but this did not happen. And this brings us to the third explanation for the discrepancy between policy and impact on the ground. The COVID-19 response prioritized middle-class Americans and the protection of the economy over keeping the vulnerable safe. Businesses were given extensive federal funding and cities rushed to reopen the economy while many residents were still in crisis and struggling to cope with pandemic vulnerabilities. Labor protections and paid sick leave were not prioritized, which put poorer Americans at risk of infection at work. Middle-class Americans were able to work from home because poorly paid workers continued to labor in factories, shipping warehouses, meatpacking plants, agricultural sites, and along delivery routes. A healthcare provider we interviewed who works at a federal qualified health center in Albany Park explained to us, our patients were doing construction, housekeeping, working in grocery stores, factories, Amazon. They were in jobs with very few rights as workers. They had employers putting them in harm's way or not letting them follow safety precautions. They didn't have the option of complaining. It was either they did the work or they got fired. In these marginalized groups, there are very few options to speak up and advocate for yourself. So we have a lot of patients coming in that were sick and they were getting it at work. I feel like people were trying to be as safe as they could be. The fourth explanation our research provides for the failure of existing policy to meet existing needs is that there were multiple problems with the ways that social assistance was made available during the pandemic. As we detail throughout the report, multiple social assistance strategies were utilized by federal, state, and local governments, including stimulus payments, increases in unemployment, and rental assistance. But at best, social assistance efforts have offered minimal harm reduction when more extensive resource allocation was really necessary to offset existing structural inequalities. Further, financial and housing support were offered in a reactive fashion after residents had already experienced mounting debt, job loss, and financial insecurity. On top of that, residents often faced bureaucratic barriers, and accessing financial and housing support or payouts were very delayed. In Chicago specifically, there were primarily two different kinds of aid that were offered to vulnerable residents. First, there was testing, contact tracing, and vaccine programming. And second, emergency cash and rental assistance programs. Early in the pandemic, when its uneven toll became obvious, Mayor Lightfoot initiated the Racial Equity Rapid Response Team, or the RERRT. And this brought together city officials, epidemiologists, health providers, and community organizers in areas of the city that were very hard hit by coronavirus infections. Using epidemiological data on infections, hospitalizations, and deaths, and when available, vaccine uptake, these stakeholders designed testing and then vaccine drives in certain vulnerable communities. So on the left-hand side of the screen, we see the initial 6 neighborhoods that were targeted by the Racial Equity Rapid Response Team, which included Austin and Little Village, which were the 2 neighborhoods that we sampled, as well as Pilsen, Belmont Cragen, South Shore, and Auburn Gresham. And these communities were targeted for education, food insecurity delivery, food delivery, educational resources, testing, and contact tracing. And then once vaccines became available, the city initiated the Protect Chicago Plus, which targeted 15 of the most vulnerable communities for massive vaccine campaigns across those areas. And these, on the right-hand side of the screen, you can see the 15 neighborhoods and the dates when their vaccine drives were sort of launched. So in the initial RERR response with the 6 neighborhoods and then the 15 neighborhoods for vaccine distribution, the city really tried to prioritize vulnerable communities for additional assistance with testing, education, some food distribution, as well as vaccines. However, by sort of targeting particular kinds of neighborhoods, many communities felt that they were being pitted against one another. And we found in our interviews that even within some of these communities, residents still struggled to access testing and vaccines. With housing and financial support, residents were asked to demonstrate that they had existing vulnerability before resources could be allocated. So implementing social benefits through means testing, where burdens rest on residents to prove their eligibility, is part of a very long tradition in the United States designed to prevent attempts to defraud the system. Implemented in this way, social benefits include complex and cumbersome requirements of bureaucratic proof to access, and this creates tremendous barriers for the most vulnerable. On this slide, we see the various different application statuses that could happen to you as you were applying for emergency rental assistance in Chicago. But the barriers that folks faced included language, technology, and computer obstacles, short windows of time to produce proof, delayed delivery of funds if applications were accepted, and obstacles associated with childcare and work schedules. This is a slide that estimates on the left-hand side the number of households that were behind on rent in all of Illinois, and that's or who are behind on rent in all of Illinois, and that's 299,203. And then on the right-hand side, we see that 111,356 applications have been approved and 57,013 have been funded. In addition, there's several explanations for this kind of large disparity that we see here. Tenants had to rely on their landlords to be willing to provide documentation. For this, Latinx resident, for example, from Albany Park, this was sometimes a barrier. So this person explains, I don't have legal documents. It's very complicated to get any kind of support because we don't have the stimulus check. And also they wanted me to talk with the landlord so that they can send him rental assistance. The problem is that the homeowner doesn't want to provide information that they ask for because the homeowner has to give their tax number. Another Latinx man from Little Village explained all the bureaucratic barriers that people faced in filing for emergency and rental assistance. Sorry. There were a lot of different deadlines with a lot of documentation required to get housing assistance for rent. You needed to show contracts signed by landlords. A lot of families don't necessarily enter those contracts. They pay by month. So getting certain documents and getting them in a short period of time before the money ran out or before the application period quit, that was a barrier. So again, these are the numbers that sort of show the need that's estimated and the number of applications that have been approved. So clearly these funds, and this is not, again, not a problem that's specific to Illinois, but these funds are not being dispersed efficiently, and they don't necessarily meet existing need. In addition, they don't necessarily even illustrate the number of people who are in sort of informal arrangements who aren't even able to apply for these kinds of funds. So In addition, many of these funds have been so delayed that many residents have already lost their housing. They've been illegally or informally evicted, or many chose to move rather than face formal eviction. In sum, then, instead of the government designing policies to keep poor people safe, including canceling rent, offering paid sick leave and work protections, and providing cash assistance and free medical treatment across hospital systems, it forced people to expose themselves to dangerous infectious situations at work, in public spaces, and at home, so that middle-class Americans and business profits could be prioritized. The racial equity measures put in place by stakeholders involved in the Racial Equity Rapid Response Team were in many ways hugely successful. Epidemiological data was successfully deployed to direct testing, contact tracing, and vaccine programming, and resources to vulnerable areas in the city. In addition, the city employed a hyperlocal lens that drew on community organizations' local knowledge and connections to achieve community trust. As a result, City of Chicago officials were able to track positivity, hospitalizations, and death rates at census tract levels and respond to surges and outbreaks with local supplies. Further, Chicago officials fought to achieve equity in vaccine distribution once vaccines were widely available. These are extremely laudable achievements. And yet, as we explain here and in the report itself, the city was unable to successfully meet the extensive needs of vulnerable Chicagoans who already faced pre-existing structural inequalities. The city often used a scarcity framework to allocate meager resources, and it prioritized certain kinds of vulnerability in certain communities over others. Resources were therefore triaged in ways that often rendered broader structural problems invisible or unaddressed. Thank you.
Thanks so much, Claire. I'm thrilled now to be able to introduce panelists who are going to offer their insights. I'm going to introduce them all, and then we will hear from them one at a time. We're going to begin with Dr. David Ansell, who is Rush's first leader of community health equity. Dr. Ansell leads Rush's strategy to be a catalyst for community health and economic vitality on Chicago's West Side. He previously was Rush's senior vice president, the center's first chief medical officer, as well as the Michael E. Kelly, MD, presidential professor at Rush Medical College. Then we'll hear from Arturo Carrillo, who is a licensed clinical social worker and director of violence prevention and neighborhood health initiatives at Brighton Park Neighborhood Council. He has been a leader in advocating for equity and access to mental health services throughout low-income communities in the city. Then we'll hear from Danae Kovac, who currently works as the deputy director at Hannah Center, a Chicago area community-based nonprofit working to meet the needs of Korean, Asian American, and multi-ethnic immigrant communities and to build power towards systemic change. As deputy director, Danae provides leadership in shaping HANA's strategic vision and oversees operations and programs to strengthen HANA's delivery on its mission. Next, we'll hear from Deborah Wesley, a social entrepreneur, leader, and community builder, as well as the founder of the Sinai Community Institute, where she serves as president. The Sinai Community Institute is a health system-based social service organization with 25 programs and over 25,000 clients per year. She is also Sinai Health System's executive vice president for community outreach. And finally, we will hear from Dr. Wayne Giles, the dean of the School of Public Health at the University of Illinois at Chicago. Prior to joining UIC, he spent 25 years at the Center for Disease Control and Prevention, where he led the Division for Heart Disease and Stroke Prevention, the Division of Population Health, and the Division of Adult and Community Health. All right, David, it's all you. Thanks.
Well, thank you, and thank you for the invitation and the terrific report. You know, there's not much to add to what was said. I mean, you know, what we shouldn't be surprised that the pre-existing social vulnerability determined literally life and death during the pandemic, and that the response was therefore inadequate because it was too little and oftentimes late. So in that sense, is for people who were surprised by the COVID lethality and hospitalization rates, need to understand that this is true for almost any measure of both black, white, or black, white, brown, or wealthier, less wealthy outcomes across the whole country. I mean, there's nothing new here. In fact, whether it's infectious disease like COVID, it was no different during the H1N1 pandemic. It was no different during HIV/AIDS. Who lived and who died was never determined by biological vulnerability, but always determined by social vulnerability. One can go back to as far back as you want to go, a JAMA article in 1956 about the polio epidemic in Chicago that disproportionately harmed Black children on the west and south sides of the city. So the surprise is if we're surprised at these types of outcomes, because the pre-existing is a clear mention, social vulnerability predetermine the outcomes. I just wanted to dive in a little deeper about system failure here. We geared up our ICU beds across the city, and we were able to withstand the full brunt of the various peaks of the pandemic with enough technical resources, in a sense that we had enough. We weren't like some parts of the world, like Milan or India, or even some parts of the United States, New York City, where we had these huge gaps in those types of resources. But the failure to quickly get in to those communities that were historically most vulnerable or historically made the most marginalized was a weakness of not only this pandemic response, but almost of everyone prior to this. I was around, for those of you around for the 1995 heat wave, it was a similar kind of problem. So I want to acknowledge that the analysis and the underlying problems that pre-existed the pandemic and the failure of the resources to meet the need, I just acknowledge that as fact. But I want to talk a little bit about, what were some of the things that create potential for the future in this work. And so, I sat on the Racial Equity Rapid Response with a couple of other panelists here. And I think for the first time in my memory, is city government brought community voice closer to the power-making decision table at the city. And that was critically important, though it couldn't meet the need. So that was one good thing that happened. And following that, the city has created 6 health equity zones to look at things like vaccine distribution over time, but also how do we get to the underlying pandemic of chronic disease, poverty, social isolation, the behavioral health issues that were mentioned. How do we organize ourselves in a more integrated way across community providers and healthcare providers to provide more of an integrated social safety net? And whether these initiatives are going to work or not, they're at very least a step in the right direction. I'm with the right amount of resources, modestly hopeful that they could begin to make a difference moving forward. Oftentimes we think of the safety net as buildings and services, but sometimes it comes down to just the individuals who know to reach out to someone else and check in on someone else. And hopefully moving forward, we can think more creatively. We failed in every pandemic that we faced thus far in my lifetime. So one would have to be a little bit cynical that we're going to succeed the next time, but at least this structure creates the possibility of future success. So I'll maybe stop there and hand off to one of the next panelists to reflect on this situation. Maybe just end on this note. Like, how do you measure ultimate success? And certainly there was a huge amount of suffering, and one can't minimize the amount of mental health, lost years of school, lost work, and everything else. From a high level, looking at mortality, Chicago is the third largest city, but seventh in COVID mortality. I think we did a better job in many. 77% of the city has received at least one vaccination. And so I think that there's, we did some things that in the long run made a difference, but maybe came short in an overarching way. But I'll end there and pass it on to one of the other panelists.
Thanks, David. Arturo, it's all you.
Yeah, thank you. Well, once again, thank you for the amazing report that was put together. I understand just the enormous undertaking it was to do this level of research, but it's very important, right? If we don't learn from the failures of this pandemic, we are doomed for the next one as well, right? So, I think there's a lot of lessons to draw. I'll speak from my perspective as a director for health and violence prevention at Brighton Park Neighborhood Council. I was hired on a few weeks before the stay-at-home order went out. So I started my position in March of 2020. And at that time, we had many concerns, but we didn't know how far-reaching this pandemic was going to be. And of course, we found out really quickly that it was as bad as we all imagined. One of my first projects within Brighton Park Neighborhood Council was to do a needs assessment in early April to understand what the needs were going to be of residents in the community. And, I'm here to share a few findings, but, of course, this is not about one specific neighborhood, although it is indicative of where and how policy failures translated into the lives of Black and Brown residents of the city of Chicago. So in April, we found that 55% of the people we surveyed in our community were already worried about housing instability. By October, when we repeated the same study, we found that 91% of residents were dealing with some sort of fear around being able to stay afloat with rent or their mortgage. And that was very much one of the first failures of this administration. The Lori Lightfoot administration was very slow to react to the housing crisis that was developing. I do want to remind everyone, early in April, there was an announcement that there would be rental assistance for community residents where $1,000 were going to be given to 2,000 applicants. 83,000 people applied for that. And it was, again, a very Hunger Games moment where people were fighting for manufactured scarcity. We know that the city does have and had an abundance of resources at that point to address the immediate needs, but there was a very cautious start to this pandemic. That has, of course, cascaded. Now that we've seen the moratorium eviction lifted, we of course start seeing the consequences of this, right? As researchers mentioned in this report, the fact that rental assistance was given to landlords and required landlord cooperation limited the access that people had to that sort of relief. It was not seen as a right, a tenant right, to get rental assistance. It was really at the behest of the landlord. Actually, this time last week, when I was tuned into panel, I was actually in the process of helping a community resident move as they were being evicted at that moment. Their industry was impacted by the COVID pandemic, and their landlord had refused to cooperate to get rental assistance for that individual. As a result, that person was being evicted. And again, as we've seen, as the moratorium is lifted, many landlords decided to not only evict individuals, but also what we've seen in the community is that rents have then been increased, right? So it's an opportunity to start increasing rents as you're kicking out old tenants. So that could lead to further fears of gentrification and other concerns of housing instability long-term. Why is that, right? Again, if the city was more proactive, as the research speaks to give more rental assistance early on, people wouldn't be far behind in their payments. We've heard that, of course, state rental assistance often did not pay back the entire amount that was owed to the landlord either. So that complicated things further. Food insecurity was a big issue as well in our early research. We found that the food insecurity definitely played a part. We found that 57% of individuals in October of 2020 were still having concerns with food insecurity. We know that factor was complicated with the ending of the emergency EBT cards that were given to CPS students. We see now longer lines at food pantries as a result to this present moment. So that was one of the biggest issues that we saw also along with our early needs assessment. And before I jump into vaccine access, because of course that's where we are today in the crisis, I don't want to lose sight of mental health, and mental health concerns have been something that has been an issue that this administration has not gone far enough on. We know for a fact that we, through our research, have found that mental health access barriers still exist for residents, not only in Brighton Park, but throughout the city. The Collaborative for Community Wellness, which is a coalition of over 70 organizations, has done research, and that research has shown citywide need of 94% of Chicago residents demonstrating at this current moment. This is research that was done between August of 2021 and March of, August 2020 and March of 2021. We found that there was an overwhelming need for mental health services by Chicago's residents. You know, once again, we have an administration, we have a mayor who promised to reopen public mental health centers as part of her campaign promise. As this report indicates, that has been one of the biggest failures of this administration. She promised $25 million to reopen public mental health centers in the city of Chicago. And what was really kind of the salt on the open wound moment that I really want to point out to during this pandemic is that the city received over $600 million of specifically $470 million of discretionary CARES Act funding that were at the mayor's discretion to spend $470 million that could have been used to reopen public mental health sector clinics and be able to establish that infrastructure in the city of Chicago. She ran on a campaign promise once again to reopen the clinics at a cost of $25 million. Instead, she single-handedly, because she had the full authority to do so, invested $281 million of federal relief dollars to the police. That money could have gone to not only reopening public mental health centers, but funding all the issues that we're talking about. $281 million went to policing, on top of the $1.7 billion that the city spends on policing every year. And kind of what was really the kind of the salt in the wound was that $68 million was left unspent of CARES Act funding. So that was before the $1.9 billion that was delivered to the city. You know, for us as a collaborative for community wellness, we called for the $1.9 billion of federal relief to set aside at least $100 million to establish public mental health centers and a citywide crisis response system that could respond to the needs of people throughout the city. This administration has failed to do so. As a result, what we've seen is unfortunately the last long opportunity we had in the city to reimagine public mental health and public safety in a way that could be initiated with federal dollars. That opportunity has come and gone because, again, there's been a failure of vision by this administration. Finally, I'll end by talking about vaccine rollout. You know, the University of Chicago recently released a report that quantified the life lost, how many people lost their lives unnecessarily because of the failed rollout of vaccine distribution in the city of Chicago. Researchers at the University of Chicago calculate that at least 118 people lost their lives unnecessarily given to the inequities in vaccine rollout in the city of Chicago. You know, this is 118 families who today would have loved ones with us if it wasn't for the unequal distribution. And unfortunately, you know, it's been an area that has not been questioned enough, right? You know, because an administration uses the word equity does not give them full cover to actually examine if they were actually being equitable in their distribution of vaccines. And what we saw in Brighton Park, specifically in Brighton Park, we saw that the Protect Chicago Plus communities that were highlighted in the previous slides by the researchers, those neighborhoods excluded high needs community areas like Hermosa and Brighton Park. Both community neighborhood areas were within zip codes that were among the top 2 zip codes in the entire state of positivity throughout the entire pandemic. Yet the Protect Chicago Plus excluded Brighton Park and Hermosa. And, you know, for us, we at Brighton Park Neighborhood Council really called attention to this issue in March when vaccine rollouts, when the vaccines were in high demand in communities and we could not get enough access. And unfortunately, you know, that fell on deaf ears with this administration. Now we can see the calculated loss of life as a result of these failed policies. So, there's much more we could say about the failures of this administration during this pandemic, but unfortunately, what's harder to swallow is the legacy that this is going to leave behind, right? The lack of vision has not made a dent and will not make a dent long term in the structural reforms that are necessary to address these inequities for Chicago's residents. And having over $2 billion to do these type of reforms and not to see them happen is unfortunately what's going to be the biggest stain on this moment of history. So thank you.
I'm muted. Sorry. Thank you, Arturo. Danae, it's all you. Thanks.
Yeah, thank you so much. And I just wanted to start by saying thank you to UIC for putting together this really great report to share with everyone. And also thank you so much for inviting Hana Center to be part of this event tonight to respond to it. As was previously mentioned, I'm part of Hana Center, which is a community-based organization which is headquartered in Albany Park. And we also have a satellite office in Prospect Heights. We work with about 14,000 people every year. About 60% of the individuals we work with are Asian American and about 30% are Latinx, which really kind of reflects, a lot of those demographics that we see in Albany Park. And I just wanted to share, some of our perspective of what we've seen over the past almost 2 years, as well as some of the responses that we've tried to implement to meet many of these needs that have already been talked about. So, earlier it was talked about how this pandemic has really just been very multifaceted for communities. It's not just a health crisis. And in the Asian American community, we also experienced this with the dual pandemic of rising anti-Asian hate. Everything from calling it Kung flu or Chinese virus to actual assaults on elders and many other people, verbal, physical violence and abuse, which also just really increased fear in the community. And unfortunately, that's something, that continues to go on to this day. There were over 3,000 incidences of anti-Asian hate reported across the US in the first year. And even in the past couple of months, there have been hate mail letters that were sent to Asian American businesses around the Chicago area that were purporting to try to pretend like they were, from judges and seeking to intimidate business owners. And of course, as you know, there was also the Atlanta murders during this time. And so I think that also just put a whole other layer of fear in the community. We also, saw many of the same challenges that have already been mentioned in the report for community members to be able to access needed services, the burden being put on community members to provide documentation that was either difficult or to obtain, or that they were dependent on someone else like a landlord to supply. I think, there have really been a significant number of failures with the rental assistance programs, particularly. Two things that I would highlight. One is really that the fact that landlords really had to be willing to cooperate to accept the assistance, and that continues to be true even in the assistance that is being put out now. And many of our community members, their landlords are just refusing to cooperate because tax implications, or perhaps they're in a less than legal rental situation that they don't want, other people to know about. And so unfortunately, that leaves community members in a position where they're not able to access that. And I think really that disconnect between the intention of the program and then what's really happening on the ground for community members is really seen there. We also had community members who initially in COVID really did everything in their power not to fall behind on their rent, borrowing money from family members, pooling together. And so then ultimately when, being behind on rent was really that criteria that made you eligible, they were ineligible for relief when they really were very much experiencing financial hardship still. Another issue that we saw was really language access, particularly, for people in the Asian American community. We saw this a lot in response to the pandemic unemployment assistance, which was a new process. Nobody really understood how to do it. IDES, as many of you know, was impossible to get a hold of. And even if you got a hold of them, for our community, there were no Korean speakers who could assist. So we ended up having to launch a new program to specifically try to provide language access assistance to community members who were out of jobs and really in need of this critical resource. So we created YouTube tutorial videos that people could watch because we didn't have enough staff capacity to help everybody one-on-one. And then also ended up assisting 430 community members to be able to access this, as well as providing translation for a lot of the other different types of assistance programs that have come out. It was already mentioned, but I do really want to highlight just how undocumented immigrants were really left out of COVID relief, from the stimulus checks, where those of us who are US citizens all just got a check in our bank, no questions asked. We didn't have to prove that we were deserving of it in any sort of way. But many of our undocumented community members did not receive those types of assistance. And so we, and I know other community-based programs as well, launched our own mutual aid programs where we were able to provide, some small amount of financial relief to community members. Again, trusting that they best know their needs and that they best know what they should be spending that money on for their families. We also did a lot of advocacy, particularly with the state. And I would highlight that, the Illinois Department of Human Services was really a leader in helping to make more resources available to undocumented community members, and also in partnering with community-based organizations like ours that, community members were already in contact with and were trusted resources, so that we could then help to, as quickly as possible, get those resources out to community. And then finally, I just wanted to talk a little bit about, mental health, which Arturo was touched on as well. For HANA Center, one thing that we saw, is that our staff are really these same community members that are being talked about in this report, them and their families as well. And so everything that, is going on, even if they feel like, they have a safe place to work at HANA Center, they have family members who are having to go to jobs where they're not protected and that they're at risk, contracting COVID. As well as they're dealing with community members who have, escalated levels of anxiety and fear, and then are calling them and yelling at the staff members. And, so everything is just sort of heightened. And so thinking about, how we are able to take care of our team and continue to support them so that we can then help to meet the needs of our community has been really a big issue, not only I know for us, but other community organizations who are also providing these types of services. And so I think thinking about, how do we kind of support the supporters so that communities are really able to access needed resources and do so in a way that's sustainable. So like we said, we're learning from our mistakes and we're not kind of just repeating this as we move forward is really important as well. And then finally, I think as a community-based organization, we also spent a lot of time. And I think there was also, a lack of leadership in just being able to put together protocols and, how do we safely reopen as an organization? How do we safely meet with community members? How do they feel safe coming to us? And having to really kind of create those things and have, kind of reassurance that, the businesses are also following good protocols and the government is doing things to keep people safe in all of these different environments. There was just really a lack of uniformity around that. But so at HANA Center, we really tried to be a leader in that way and share those resources with other organizations we worked with, especially those that were smaller and didn't necessarily have resources internally to develop their own procedures. So thank you.
Thanks so much, Danae. Deborah, turn it over to you.
Yes, good evening. And I also want to thank you for inviting me to this very important conversation. I so appreciated the great work that's in this report should be shared out more than this evening. It's such great work. So I want to, I said I'm the president of Sinai Community Institute, which is a health and human service organization that's under the umbrella of Sinai Chicago, otherwise known as Sinai Health System. So I'm in a unique position because I do serve on the Racial Equity Rapid Response Council. And I'm also an active member in the chair of Westside United. And the work that's being done is really around the life expectancy and addressing that and getting at what's the root cause of a lot of the issues that we're talking about. That being said, I really want to share out some lessons that I've learned over time, and particularly as it relates to COVID and the experiences that I've had. So the one thing that I've learned is that our community members do not want to be victims. They want to be listened to. They want us to hear them. They want us to speak the truth and recognize that there's a source of pain that has to be addressed. And that's where you get to the racism. And that any response that's going to impact the community has to include the community at the table. And the other thing that I've learned working with, particularly in North Lawndale, is our community. We learned that we can work together and we can do this. We can roll up our sleeves and we can come together as a united front and fight for ourselves, because that's real important. The other thing that I want to say is, as policies are being made and processes are being established to address those policies, we need to ask the question, how's that going to happen? And we have to do it in the context of the lived experiences of the people that we're talking about impacting their lives. So if we say you need to quarantine in the home, and you have individuals that have a 1-bedroom with multiple people in there, how's that going to happen? And so there's been this blind spot that's occurred, I don't think intentionally, but it's out of, to some extent, ignorance and not really, wanting to put the fire out, but not understanding the underlying cause of the fire kind of thing. So I want to share kind of one thing, an example of what we've been doing in North Lawndale. As you showed the map, North Lawndale was not on the front of the first community, one of the first 5 communities to be targeted. We came along later, but the fact of the matter is, in North Lawndale, we knew that we're having a lot of people that are being impacted by COVID, that were dying. So what we did is we came together and said, let's create a COVID task force that's hyper-focused on North Lawndale. So we pulled together community members, community partners, philanthropic partners, to really drill down on what's going on in our community. And we started by actually doing a survey in our community to say, how's this affecting your life? What do you need? What's going on? How has your life changed because of COVID? And so it's just interesting because a lot of the responses really mimic your report. We found that they needed help with their housing. We found it around the utilities. We're sitting in a food desert. So, I mean, when you're running around and no grocery stores. So if you need toilet paper, which is an essential basic need, where do you get it from? Everyone doesn't have a membership at Costco where they can buy a large package of that type of thing. And folks wanted to work. And then the other thing was the fear of, how do I educate my child? I run an after-school program right now, and 1/3 of our children have IEPs, educational plans. That's a challenge, not only for them, but for the parents. How do you keep them on track? We're also talking about the digital divide in terms of those being basic issues on there. So what we decided to do is we're going to be hyper-focused on what's going on in our community. We established a helpline, both from a phone number, here you can call, go online, just tell us what you need and let's link you to what, and let's try to get it done. There's an urgency, even in the Racial Equity Council, I kept hearing and continue to hear, there's an urgency. We cannot wait for extensive processes and a lot of blessing on them. We just need to get her done. And that's kind of the way we were doing it. So one of the ways we did it is we took that information, we created this helpline. We, for those who were having challenges with their rent or their mortgage, we actually established a compassion fund. So that was a fund that was funded by private individuals and private sector, so that we could help pay, get it done, so they're not put on the street. And that was great. While we work while we allow the process that was being put forth to come into fruition. We also, one of the things we want to do is message to our community around COVID, what's going on. So we created, very creative, our own song and video and pushed it out in the community. And it is called Sound the Alarm. And so that they can understand that this is serious. And yes, there are issues. There's a lot of miscommunication that's going on. One of the things as I'm thinking about it is we have to continue to work with government. Government has to work to the state, the city, the feds. And there was a disconnect that I saw. And we have to take the politics out of this and allow the science to drive a lot of what's going on, because the politicization is one of the ways that has created a disconnect in our community, because they're looking and reading things and listening to all of this misinformation. So that's one of the things. Then we also were able to get establish a fund so we can do a food delivery into our homes of our community. So right now we deliver food, healthy food, to 400 families twice a month. And it's been amazing. And they've been very grateful for that. And we're very happy to do that. We also created a lot of virtual education around COVID, a lot of misinformation. We had to figure out how to get that information. We had a youth-focused one. We even brought our employers together, particularly our small businesses. They wanted to know, what do we do? How do I bring my workforce? How do I prepare? So by having institutions like Sinai and Rush and Westside United, we can give them the tools to be able to do that. So I'm really looking at what do we do from a solution-based piece of it, from a community-based point of view of issues, very serious issues that's really killing our community. So I'm going to stop here by saying, I want to leave the message. We have to listen. We have to hear what the community has to say. There is a voice, and their voice needs to be heard and respected. And they also need to be a part of planning and the implementation of whatever is going to drill down into our community. So I'll stop there and take questions later. So again, but thank you so much.
Thank you so much, Deborah. Turning it to you, Wayne. Thanks.
Great, thanks everyone. And it's great to be here and to be on this amazing panel this evening. And I want to thank IIRP for their really comprehensive and so timely and really, really vitally important report that they're releasing. You know, I was reflecting back and I was thinking, you know, if in 2019, you know, we had a group of UIC students who we said to them, there's going to be a pandemic in the next year. It's going to be airborne, and sort of, can you predict the communities that are going to be impacted by that? And my guess is that they would have predicted the communities that we currently see and were in fact impacted by that, right? And it's because of the structural factors that you all highlight in this report, right? It's lack of access to care, it's lack of power in terms of your employment, it's housing issues, it's mental health, it's lack of a safety net. And my guess is those students would have said, this is where we're going to see an impact. And I'm going to come back to that in a minute, because I think it gets at sort of what we're doing wrong here. And I agree with Deborah and David. I think the work of the RART and having community voice at the table has been really impactful, and I think has made everyone's work better. And we see that over and over again. However, I also think that the work that the RART has done has been very reactionary, right? So it's where are the low testing rates? It's where is the low rates of vaccine uptake, et cetera. And I think we have a missed opportunity here because we have some really powerful voices at the table, but there's an opportunity for us, instead of being reactionary, to be proactive and to engage community members in a discussion about what are the structural factors that need to be changed within the city. And we haven't had that conversation yet, but that conversation really fundamentally needs to occur. I think, in addition to that, David talked about the 6 health equity zones. And again, community voice is at the table as part of the health equity zone work that's being done. But those health equity zones are focused on vaccine and vaccine uptake. But again, it's a missed opportunity because here's an opportunity for them to also be focused on some of those structural factors that are so vitally important. But unfortunately, my understanding is that's not happening yet. I also was reflecting about sort of, what we saw in May of 2020, where we saw that huge increase in COVID cases in the Black community. And then we saw an increase in the Latinx community that even surpassed what we saw in the Black community. And I bring it up because, and this is something that Arturo talked about, we have the data for the 77 communities across the city, but we didn't have transparent data at a hyper-local level at the census tract level. And so people really couldn't see areas where they wanted to target. There was some conversations in select groups where you saw hyper-local data, but it wasn't something that was transparent. And even today with vaccines, we can get vaccine data at the zip code level, but we can't get that hyper-local approach that we need to, that would have highlighted different communities. And I think we just need to be more transparent. And I think the state needs to be more transparent in having that data available. In addition to that, right, we're all now being told about boosters and the importance of boosting and sort of why that's vitally important. But I haven't seen any reports from anybody about sort of what are the rates of boosting and how does that differ by community level, et cetera. And I think that's an important aspect as well. I also want to mention sort of, the multiple demics, because I really like that theme that was part of this work. And we see unequal burden of chronic conditions, asthma, diabetes, hypertension, et cetera. And we know the lack of control of each of every one of those conditions makes COVID worse. And folks have talked about mental health as well. And I think all of that shows the multiple traumas that our communities our experience. And again, we need to be thinking about more holistic approaches that address these structural factors. My final comment for the group today is that I think we need to remember very much that our borders are fluid. And we are very focused on Chicago, and that's really appropriate, but we need to also remember that folks cross their city borders, they go into suburban Cook County and the other collar counties as well. And so I bring it up because I think a lot of these factors, a lot of our interventions are structural factors. We need to also have reports in those collar counties around the city, and I would argue for the state as well. So just a couple of initial thoughts that I have, and I hope we can, sort of as we listen to community voices, as we develop interventions, we can be less reactive and more proactive and address those structural factors. And with that, I will turn things back over to Amanda.
Thanks so much, Wayne. So I want to pick up on that last point. I'm going to kick a question to anybody who wants to take it first. But you were talking about these multiple demics that one of the respondents talked about. And I was thinking about, David, what you mentioned at the very beginning about how the rear policies was a kind of unique moment because the city brought community voices to the table in a new way and in a way that really made a difference. And as I was listening to Arturo and Danae and Deborah talk about the work of, West Side United, Hana Center, the Brighton Park Neighborhood Council, I thought, I wonder what concrete steps the city could take to give communities the power and in some ways the purse to address root causes in a kind of ongoing way, as opposed to, as Ray was saying, in a kind of reactive way. So I don't know, David, if you want to start.
Well, maybe I could just take it.
Yeah.
I want to appreciate everyone's comments, obviously. The underlying pinning problems of structural racism, economic deprivation because of our economic system, and really, I call it afraid to destroy safety net. We don't have a safety net. The health department at the beginning of the pandemic had 500 people. We knew that that people who were elderly in nursing homes were vulnerable and homeless, living in shelters for the homeless. Those experiencing homelessness would be vulnerable. The jails would be vulnerable, and yet we did not have a safety net resource to address this pandemic, and therefore the shape of this pandemic, and when affected, has been like every other prior pandemic, and was 100% predictable. So there was no surprise to it. And then, of course, then we were reactive and could never face the need. It was a scarcity approach, and Arturo's right. West Garfield Park was left out too. Brighton Park was left out of while the idea of focusing vaccine on those neighborhoods with a high social vulnerability index was a good idea. It left many neighborhoods out, so it was scarcity driven. In the end, the underlying problem is how we have extracted capital and power and decision making from these neighborhoods, and so anything that's reacting to an infectious disease outbreak or a chronic disease outbreak from a medicalized point of view is going to fail if we don't simultaneously have capital infusion back in these neighborhoods at a massive scale. And while there's the Biden's Build Back Better, and which hasn't been passed yet, and the infrastructure bills brings some dollars to the table, they're inadequate to the demand. And so the solutions of these are ultimately social and economic. And unfortunately, we've linked healthcare delivery in this country to capitalism. And therefore, those who have more will always get more. And we saw that with that. So I'm just not sure that even with the infusion of dollars that have come into the city and the region, that we're prepared to distribute it to those neighborhoods that need it the most. But that's the public policy next step, is got to be around capital investment into these neighborhoods.
I could also add to that. I think one of the pitfalls of bringing community organizations to the table to be part of the policymaking is that it excludes also other people, and there becomes kind of a gatekeeper mentality. There was an absolute lack of transparency. I appreciate Dr. Giles for bringing that up in local level data. As we were calling for more vaccines to be going into Brighton Park right when the Protect Chicago Plus, we had issues with getting data from the community partner who was the gatekeeper of the data of the local region. And we didn't have access to that data. Our only options would be to FOIA for that data. And that's ridiculous. During a pandemic, we shouldn't have to be playing hide the ball on the data. at the local level. And unfortunately, that was what was happening. So when we were trying to point out the fact of this disparity, and the city is looking to those same community partners to applaud its reaction to the vaccine rollout, ultimately the games that are being played cost people's lives. So I do feel like moving forward, if we are not pulling lessons from how we have to depoliticize the Department of Public Health, how maybe the commissioner for the Department of Public Health shouldn't be a mayoral appointee, how maybe data that flows from the Department of Public Health to community level should be put on public accessible portals like the CDPH website instead of handed to and made given for safekeeping to community local partners. Like, these are lessons, and transparency matters, and it costs people's lives if we don't allow for that sort of transparency. So, decision making is made based on data, and data is power, and information is power. So we want to make sure we open the channels for power sharing in the city.
Anyone else want to jump in that? Deborah, go ahead. Looks like you.
Yeah, I was going to say, and I've been very vocal about this as the city drills down and leans on our communities. They've got to bring resources. Many of our organizations are made up of volunteers, and it's so you cannot expect the communities to be able to sustain these major issues in a way that will have a long-lasting approach. Resources have to be put forth to help do that. It kind of follows what David was saying. It's just at some point, because folks want to work, they want to change what's going on, the narrative, but we got to make sure that they're supported in a meaningful way.
If they want, go ahead.
Oh, I was just going to say, to add to that, I think really, hopefully people have seen that there needs to be substantial structural change too, and kind of how those resources come to neighborhoods. I was on a call the other week with a lot of community-based organizations where we were talking about rolling out a new cash assistance program for undocumented or mixed status families, which is still, there's so much of a need for that, but that's still just a Band-Aid, right? And how really for families to come out of COVID and to be able to thrive, we have to address these larger structural issues that are leading to communities like ours being affected disproportionately. And think about how people can access healthcare or education or employment or safety and all these different things, and not just, give $1,000 Band-Aid, which is still very much needed because people need food, they need, supplies, they need to keep their lights on. But if that's all we're doing, we're really not addressing the root causes of what got us here in the first place.
And maybe the problem, this is David again, I had someone ask, what would be the scale of capital infusion into our neighborhoods in Chicago that would raise all the neighborhoods to be middle class? And this was this person, it estimated to be about $250 billion. And, I don't know if that number is correct or not. On the West Side, it would be about 70 or 80 billion dollars. And so let's just say that number is reasonably correct. It's not an outlandish number considering how much we invested in the war in Iraq and Afghanistan, which was $5 trillion. But it puts the scale, at least puts the scale of where we should be to where we are. And that's, I think that's the gap right now, right? It's a gap between, so I do applaud, Mayor Lightfoot for Invest Southwest. But there are things like the Chicago Prize where you have communities competing against each other, like carnivores for a $10 million prize, which is, I'm glad there's a prize, but in which it vastly, is undersized compared to the need. It wouldn't be bad to validate what is the amount, and maybe Claire, this is your next paper that we do. What's the amount of capital investment that's needed to bring these neighborhoods up. We've already had the report, the cost of segregation and the cost to our region, $4 billion a year in loss just by not being average. But what is the actual gap? Because if we started with knowing what the actual gap is, we could maybe begin to solve it proactively, because we're always going to be reactive to a pandemic. We're never going to be able to be responsive. And people are going to die because of the policy decisions and our inability to act, not our ability to know. As Wayne said, any public health student in the United States could have told you where the excess deaths were, where the bodies were going to lie. We just could not mobilize quickly enough at a scale enough to actually do it. But if we want to be proactive, we've got to get to the sort of the economic development and that broader safety net questions.
If I could.
Oh yeah, go ahead, Claire.
I was just going to jump in and kind of piggyback on both what David said, but also what Danae said about delivery also, because a lot of folks who were trying to ask or who could have really benefited from rental assistance are in sort of informal arrangements that, disqualified them from even being considered. And so, housing really needs to be an entitlement, and it needs to not be on these kind of like means tested basis for receiving aid. And so I think that, and as David mentioned, like our health system, of course, is extremely driven by capitalist incentive. And so we have hospitals that are private, entities that we can't really touch with public policy. And so I think that a lot of this also has to do with like the capacity of delivery and needing to reorient the way that we think about health and housing.
I'll also just quickly chime in also. I think one of the questions from the reader, from one of the attendees here, talks to the impacts of neoliberalism. And I think that is definitely one of the things we need to name in this entire process. We've gutted the public infrastructure in the city of Chicago. As a result, as Dr. Ansel mentions, right, the Department of Public Health was woefully understaffed and underfunded at the beginning of this pandemic. As a result, we then offloaded the responsibility of contact tracing to the nonprofit sector, again, the private sector. As a result, contact tracing in the city of Chicago was a failure. And at the end of the day, that cost people's lives as well. There was not enough workforce enforcement of safety, and that shows up in this report, right? So the spread is happening at the workplace, and there's not enough government intervention there. So the impacts of neoliberalism definitely do play out. And rebuilding the public infrastructure, again, is part of the opportunity loss that I'm talking about. With federal relief, we could have started rebuilding that infrastructure. My fear is that after federal relief is weaned off in 2 years, we're going to go back to bare bones public infrastructure once again.
We are almost out of time. I have one final question. I'm going to kick it to you first, Wayne, so get ready. One of the things that the report pointed out, and that a lot of you talked about in different ways, is that a lot of communities in Chicago have been in crisis for a long time. So that we have a pandemic that's new, but the ongoing social and economic crisis in a lot of communities has been ongoing, which has led to what Deborah mentioned about gaps in life expectancy. Dr. Ansel's written about this as the death gap, or the years of lost life. And I keep thinking in this conversation what it would mean to live in a society that actually takes care of the human beings that are a part of our communities in kind of an ongoing way. So I'm just wondering if you think there's anything we've learned in this moment. Has the crisis in any way been an opportunity to shift how we do things for the better? Are there things that we've done now that we should keep doing in any way as a kind of at least getting something out of this moment?
Yeah, so I mean, a couple of things that I would say. One, we do know that this, as several folks have said, this community engaged process is a really value. I think it makes the work that we all do better. But it's right now it's very health department focused. But a lot of the issues that we're talking about, whether it's around economic development, housing, et cetera, are sort of out of sort of the public health sector, but they're the major determinants of health and well-being. And so I think thinking about sort of how we could have a more community engaged process that cuts across those other sectors, education, et cetera, I think is fundamentally important. I think, this isn't just us, this isn't just a city issue. I mean, and that's sort of why I talk about fluid borders, because I do think, right, these are discussions we need to be having at the state level, and at the federal level as well. And I think mobilizing communities to say, we need to be addressing these structural factors so that the funding is flowing in the way it is flowing. And I love the analysis that David suggested, because I do think we could redirect resources to help to support communities in the way that they need to be supported. But again, I think it's largely about advocating, not just with city government, but advocating much more broader at the state and at the national level as well.
We are out of time, but I want to just give everybody just a chance for one final thought, either on that question or just something that you're holding on to before we end the whole conversation. I don't know who wants to. David, you're unmuted, so maybe I'll go to you first.
Well, I think, we have a big unsolved problem of the pandemic of social injustice and inequity. And that's not just local, it's worldwide. And then what can we do in the meantime, given this? We have to be as tightly interconnected as we can be. And that comment about neoliberalism is critically important. The degradation of the public sector has forced all of us as community-based organizations, as not-for-profit organizations, as community members to figure out how can we together, even though it's inadequate, be more tightly integrated such that we can actually support each other in new ways, and then in immeasurable ways. And I think that's the intention behind an organization like Westside United that's brought hospitals and communities together. But I do think we need to think through what that can look like. Really, almost like a federated system in the absence of government and support here to actually make sure we're taking care of those who've been made most vulnerable and save the most lives and that we can in this context. I don't know what that looks like, but I think we should pursue that while we're waiting for these larger solutions.
Deborah, you want to go next?
We've got to have a major system overhaul because this is really crossing every aspect of our lives, every aspect. And it's not just in Chicago, it's across this country. And we're seeing the ugliness of it rear its head every day when you open up the newspaper or turn on TV. So this is a massive, massive undertaking that we cannot do. No one institution can do it alone. We have to come together and figure it out.
I guess I could also add, and I agree with Ms. Wesley's comments. I agree 100%. I think restructuring is definitely what we need to do. 40% of our budget in the city of Chicago still goes to policing. We have 1.9 billion. It's gone up since the pandemic started, dedicated to policing, and we cannot continue to allow for Chicago's main social service and its public sector offering being policing for community neighborhoods. I'm really fearful that once federal relief dollars go, we go back to this same split we've had always, right? Where for every dollar we're spending on policing, 2 cents is going to public health, and 5 cents is going to Department of Family and Support Services, and right, the fractions of the pennies we get for social needs in the city still remains. And I'm fearful that during this pandemic, because we have this influx of federal dollars to kind of hold us over, nothing's going to change in 2 years when that money goes away. So restructuring is definitely what's needed, and rethinking how we fully invest in communities with city revenues is just as important as we move forward.
What we've been saying is that, we can't go back to quote unquote normal. Normal was not working. And in fact, normal was actively and continues to be actively harming our communities. And so that's, I think exactly what you're saying, Arturo, is that we need, a whole overhaul. And I hope that we, moving forward, will also, really look to and listen to, learn from, follow the leadership of our directly impacted community members, who really, I think, know best what some of the solutions can be as we move forward. And I think that's really where we should be looking for more leadership and also investing in those communities to be able to move forward.
I'm probably dating myself a little bit, but I was thinking about the quote from the civil rights movement. I'm sick and tired of being sick and tired, right? And that's really where many of our communities are. I mean, I think they are sick and tired of being so sick and tired. And so I do think we need to, think about sort of what are those structural factors? How do we restructure the way we do business? And I do think it is very much about sort of having business, healthcare, community-based organizations coming together as a model. But I think it's got to be broader than just health. And I think we've got to all collectively push at that level. And then I think we also have to push not just the city, but this is national as well. So I think we just got to push on all of that. So happy to work with everyone to make that happen.
Thanks, everyone. This has been a really wonderful conversation. I wish we had more time. We'll have to do it again soon. And just a reminder that you can download the report for free at our website. The link is in the chat. It's been wonderful to see everybody this evening. Take care. Good night.